A new push for single-payer health care right here in the U.S.
Single payer, now!
Every time we go to the doctor for everything from an angioplasty to a hip replacement, from a C-section to a pain reliever.
The rent is too damn high.
We know a CT scan is costing $6,000, so I'm going to go $10,000.
95,000. So just for imaging, they've charged him $95,000. That's like more than a resident's salary in the US. Oh god, but just 1 week.
$95,000 for imaging. Did they give this man the MRI machine?
All right, Andy. The thing we're trying to do here at TFTC, which is explain things from first principles to better educate our audience what is happening, what a certain industry is, and how it got to this point. And you are an expert on healthcare. You're building Crowd Health, a company that is looking to disrupt the health insurance market, which has become notoriously corrupt. And I think before we get to what you're doing at Crowd Health to fix the problem, we have to understand the problem. Mm-hmm. So as it pertains to healthcare and health insurance, it's important to identify that problem as we understand it. And Obamacare, the Affordable Care Act, introduced a lot of market disruptions that have led health insurance to a point where it's extremely expensive, to the point where it's driving a lot of individuals bankrupt. To describe what health insurance was like, what it was like for individuals to interact with health insurance before the Affordable Care Act, and what was the justification that led to the Affordable Care Act.
Yeah, so I think that the customers had a lot more options prior to the Affordable Care Act. So there was a lot more options for somebody as an individual would go and get. Right now you have basically two options. It's the employer or the Affordable Care Act, the exchange. So you're down to two options basically. And before then there were dozens of options. The Affordable Care Act consolidated those. And the primary reason for that was that there was two problems. One was healthcare expenses were too high and growing too fast, and too many people were uninsured. So those were the two primary problems in which Obamacare tried to fix. Unfortunately, the uninsured rate before Obamacare was 7.5%. This was 2010. This is when it was signed. 2024, the uninsured rate is 7.5%. So it didn't change it at all. Zero change. Costs. Before the Obamacare, the Affordable Care Act, the United States was paying about $3,800 to $4,200, depending on how you look at it. So let's just say an average of $4,000 for a single individual. Post Affordable Care Act, we're at about $8,500, almost $9,000 an individual
Per year.
Mm-hmm. So it doubled, more than doubled. Before Obamacare, the amount we were spending on healthcare was about $2.4 trillion. We're this year at about $4.6 trillion. So all the things that Obamacare tried to fix are actually worse. The slope in which healthcare costs are increasing went up. So the healthcare costs are going faster post Obamacare than they were pre-Obamacare.
What are the specific costs that are going up?
And I just had mentioned premiums. So that was the premiums, mm-hmm. the $4,000 to almost $4,200 to now almost $9,000. It's between $8,500 and $9,000, depending on how you look at it. Deductibles have gone up even further. So right now for my family of four, my deductible for Obamacare, if I were to have taken it, was almost $14,000. So I'm paying $14,000 on top of my premiums before the health insurance plan pays a dime. Before Obamacare, for a family of four, it was somewhere around $3,000 or $4,000. So that has actually tripled. The deductibles have tripled. Premiums have doubled. Deductibles have tripled over the last, since Obamacare was signed in 2010.
Pre-Obamacare, all-in cost with your premiums and your deductibles was somewhere around $5,000 to $6,000. And now it's around, for a family of four, it's north of $20,000.
Yeah, let's do apples to apples. So before Obamacare, a single individual all-in premiums plus a deductible, assuming you used all of your deductible, you're right around $7,000 or $8,000. Now, post Obamacare, you're probably in that $16,000 to $18,000 range. For a family, pre-Obamacare, it was around say $16,000, $14,000 to $16,000. Post Obamacare, you're talking north of $30,000.
Which is a considerable amount of income.
Yeah.
If you're having to pay all that.
Exactly. Now they will say that there's all these subsidies that have come out. So if you're making up to 400% of the federal poverty line, the government in essence is subsidizing you back down to zero. You still have the big deductibles, but the premiums have come down considerably. So that's new with some of the COVID regulations. So they say that they're still helping the middle class, but the problem is that if you have a big health event and you have a $14,000 deductible, that means you have to come up with $14,000 out of your pocket, which the vast majority of people don't have, right? If you're single, you're coming up with $4,000 or $5,000 out of pocket. More than 50% of Americans can't come up with $1,000. They don't have $1,000 of liquid assets. So all of that leads to higher bankruptcies.
Mm-hmm. I don't know if you have the stat off the top of your head, but maybe just rough ballpark estimate of where the bankruptcy rates due to healthcare events pre-Obamacare versus post.
Yeah, to the best of our knowledge, the data isn't perfect, but it has more than doubled. Yeah, so it's somewhere around 100,000 families every year pre-Obamacare. We're at around 200,000 to 250,000, depending upon the year, post-Obamacare. And so we believe that the number of families going to bankruptcy has actually doubled. And these are for two reasons. One is the deductibles. So as I just said, if you don't have that money in your bank, you're in tough shape. The second is denied claims. So the amount of claims being denied on the Affordable Care Act plans, the exchange plans, sometimes they call them, is just south of 20%. So it's around 17 or 18%, depending upon the year. If you're here in Texas with us, we're a little above 20%. So about 1 in 5 claims are denied by the Affordable Care Act plans. So, if you have a situation like me where I had an $8,000, surgery for my daughter that got denied by an Affordable Care Act plan, if you don't have $8,000, you're in tough shape, and these hospitals will go after you.
So that's one side. There's two-sided markets here. So this is how the consumers have been affected by Obamacare, arguably or inarguably in a negative fashion. The other side is the hospital systems, the pharmacies, the people actually administering the healthcare services to these individuals who are engaging in these plans. How has it changed on that side of the market?
Yeah, I think the big change here was for the insurance plans, because the what they call the medical loss ratio, and in essence what that means is when you get $1,000 of premium, a certain percentage of that has to go to paying actual claims. So it has to go to medical care. So what they're doing is they're maximizing the amount you can take as profit. So from the outside looking in, that's great, because they're like, we don't want the health insurance plans to gouge us. But the problem with that is now the incentive structure is all messed up, because now the health insurance plans actually have an incentive for premiums to go up. So if you have $1,000 premium, just to make the math easy, they can only make $150. So if they want to increase that $150, they actually have to have premiums go up. So if premiums go up 10%, they can now make $165. So the incentive structure within the insurance plans are now such that they want medical prices to go up over, any kind of intermediate to long period of time, because that means they make more money. And therefore, that impacts the way that they can negotiate with hospitals. So if you actually could make more profit from having lower prices, you would negotiate harder with hospitals. If you want the price to go up over a long period of time, you won't negotiate with hospitals. You'll let the price creep. It's very similar to the way that the U.S. government works with military contractors. It's a cost plus system. So what happens with a cost plus system? The military contractor says, here, something cost me $1,000, you're going to give me 10% or 20% on top of that, depending on the contract is structured. So what do they have an incentive? They have an incentive to see costs go up as opposed to driving costs down. It's total counter to capitalistic society when you have governments and government-like entities like health insurance plans getting involved in free markets.
So you have hospital systems, healthcare companies, and insurance companies. I don't want to say colluding with each other, but working within a particular incentive framework where they're both comfortable with prices drifting up because they both benefit.
The buyer of healthcare, which is health insurance companies, and the seller of healthcare, which are the hospital systems primarily, all want the prices to go up. And therefore, the prices have gone up substantially over the last, especially 15 years since Obamacare came into play.
Why I think it's very important to cover this topic, particularly right now, as we live in an environment where inflation is rampant, and despite what the current administration would lead you to believe, prices are higher than they have been in quite some time. So Americans are feeling the economic pressure at the grocery store, at the gas station. And health, again, is one of the most important things. It really doesn't make sense to go do anything else throughout the economy unless you're healthy. And the fact that healthcare rates and the cost to remain healthy or seek healthcare in the event that you have an accident or need to get a medical procedure going up, it adds a lot of stress to individuals.
Every dollar of pay increase to the middle class for the last 50 years has gone to health insurance. So the middle class has adjusted for health insurance, has had zero pay raise in about 50 years. Like, that's how bad this is. So, this is really important. I know that you're into Bitcoin, so am I. The inflation, the primary driver of inflation is healthcare costs. I mean, it's $4.6 trillion every year that we spend on healthcare. If the United States healthcare was a country, it would be the fourth largest GDP in the world. I mean, that's how crazy this has gotten.
Yeah. It doesn't seem like we're going to fix it from within. So this is why Crowd Health exists.
Exactly. Yeah. It's to introduce consumerism into healthcare. And so how do you add consumerism into healthcare? People have to take self-sovereignty over their own, one, health, just the physical component of that, and two, the financial component of that. So if we have people now who are shopping and actually looking for the lowest cost yet highest quality provider, then that cost will be driven down because you have now the invisible hand trying to push prices down as opposed to the incentive system to continue to see the prices increase.
And that's why I think it's very creative, because we just described the current incentive structure between the buyer, health insurance, and the seller, the healthcare system. And you're essentially introducing a new buyer to this market with Crowd Health that creates a new incentive structure for the sellers to work within. I guess that's an important question to answer. Why would the sellers decide to participate in this new market structure with different incentives? Because
the sellers have been so hammered down by health insurance companies, especially the independent ones, not a part of the hospital system, have been so crushed by health insurance that they're looking for another option. So I'll just give you an example. Typical doctor's offices have 3 billers per every doctor. Every doctor's office, typically every doctor, spends about a day a week fighting with health insurance plans. So in essence, what this is doing is it's costing them somewhere between 30 and 45% of every dollar they bring in is the cost of billing. So, now compare that to me coming in as a consumer and say, hey, I'm going to pay with a credit card. Now your cost of doing billing is 2%, 2.5%, something like that. So I'm significantly, dramatically reducing the friction of billing for these doctors. And they get to do more of what they're good at, which is being doctors. And so they're willing to give significantly lower costs to a consumer of healthcare as opposed to a health insurance plan. That's the entire, business model. If I can pay in cash, I can get significantly lower rates than a health insurance plan can, even though some of them are some of the largest companies on the planet. I mean, United Healthcare, I think, is the 6th or 7th largest company by revenue in the world. And I, as an individual, a consumer, here's the power of consumerism. I, as a consumer, have more power than United Healthcare does when negotiating my healthcare bill, because I don't have the 30 or 40% transaction cost that United Healthcare does.
Is how many people are even aware that this problem exists, or that this option to compete with the United Healthcare in terms of negotiating pricing is even possible?
Yeah, here's my business model, right? I think most Americans know that there's a healthcare problem, because everybody I talk to, I went up in the elevator today with some guy. He's like, "Hey, what do you do?" I was like, "I'm trying to build an alternative to health insurance." He's like, "Yes, please." Almost everybody, I say, if you can have an alternative to health insurance, they'd be like, "Yes," because there's a problem. There's a problem because health insurance denies my bills. They tell me what I can and can't do, what procedures I can and can't do. They send me bills in the mail that I have no clue what they're there for. Everybody hates in health insurance. And I would say almost everybody is accurate, other than people who work for health insurance companies. And I've heard from a bunch of them too, and they hate health insurance companies and they work for them. They're only there for a paycheck. So I think everybody knows that there's a problem. Now, how many people know that there's an alternative? Hardly anybody. I'd say, less than 0.10% of the population probably knows that there's an alternative to this. And so our biggest challenge, right, is getting the word out there that there is an alternative, and then getting people to understand that they've been psyoped into thinking that health insurance is the only way. Mm-hmm. Right? I have, people like you who are members, you and your family, my family members. If we can show more that it's like, hey, this actually works, like this is actually viable, then I think that's where the inflection point happens.
Yeah, I think I'm about a month away from my 2-year anniversary, me and my family being Crowd Health community members. Yeah, it's a no-brainer as somebody who has used the service for 2 years now. It is much better user experience, much cheaper, and it's way less stressful as well, which I think is the number one thing that I value out of being a Crowd Health community member is the peace of mind I get knowing that not only are things going to be cheaper, but we have healthcare advocates and a community behind us that are actually going to make sure that we get the best care possible at the best price. Stress, what is the number one stress in most people's life? It's economic stress, financial stress, and being able to offload the financial stress that came with health insurance. I was on Cobra. It was $1,800 a month for my family of 3 at the time. My second child wasn't born yet. Now, for a family of 4, I'm paying maybe $800 a month.
You should be at like $605.
Yeah.
So you're paying a third.
Yeah.
You added a person to your family, you're still paying a third. Mm-hmm. As I mentioned before, it's somewhere between $8,500 and $9,000 for a single individual within the corporate health insurance. Our individuals are paying $185 a month, so it's about $2,000 a year.
Yeah.
So that's almost, what is that, a quarter?
A quarter.
A quarter of what it's costing others. So it does require you to be a consumer, right? And so people have to be okay and comfortable with that, but you can allow us to do that shopping for you, right? So, we had a member the other day who wanted a colonoscopy and was trying to shop around themselves and found one for $3,700. We found one right down the road for $1,200. This is a colonoscopy. Like, this is, a pretty commodity type of thing. And that's the difference of prices for somebody. I think they were a couple miles from each other. Like, that's how impactful that this can be if you actually do a little bit of work, or let us do the work for you, because we're happy to do that. We prefer to do that.
65% off.
Yeah, exactly.
That was the eye-opening thing for me. The experience of a Crowd Health community member It's funny when we go to the doctors, we ever have a procedure or anything, they're like, oh, it's hilarious how taken for granted have an alternative to health insurance is, because every time we go to the front desk at a doctor's office or we're at the ER or urgent care, whatever it may be, it's like, give me your ID and your health insurance.
Yes.
Yeah, we're not in health insurance, we're paying cash. And
Yeah.
then they're like, oh my gosh, like, what's wrong? Are you poor? Even on the healthcare side, the secretaries, the assistants, it's very rare for them to ever encounter a Crowd Health community member that's like, no, I'm gonna shop around and make sure that I'm getting the best price here.
Yeah, I mean, that's the one thing people have to just get over. You know, it's like, go and say uninsured. Like, we have got to get over this, like, uninsured equals poor or whatever. And it's like, no, uninsured equals freedom. Like, you are no longer bound by the limitations of some centralized decision maker, in this case, insurance. You are self-sovereign. You can make your own decisions, pay with your own money. Like, that's great. And in the big ones, like, we just had a NICU baby. One was like $350,000. Another one was $150,000. You know, we negotiated $150,000. We negotiated down to $18,000 and got that funded by the community. You know, the $350,000 looks like it's going to be somewhere like $50,000. And that one's going to get funded by the community. It's like, so even the big ones, motorcycle accidents, heart issues, brain surgeries, brain hemorrhages, I mean, everything, you can name it, non-Hodgkin's lymphoma, colon cancer, breast cancer. All of these have gotten funded by the community at prices that are conservatively half of what the health insurance plans would pay for the same procedures or drugs or whatever. There was a drug, $40,000 a month drug. We negotiated down to $3,000. So it happens on the pharmaceutical side too. You tear out the pharmacy benefit managers, the PBMs, as a lot of people know them, and you go directly to the supplier, and you can get significant discounts with pharma too. 90% discounts.
For the benefit of us out there who are unaware of how this actually works, when you go to pay these bills as a Crowd Health community member, what's happening between the time you either set up a procedure, get a bill, bring it to Crowd Health, and then eventually get it crowdfunded and paid for.
Yeah. If you have a big one, just call us. You know, if you tear your ACL playing pickleball like we had in, you know, Austin a few months ago, just call us and say, hey, this is what happened. And then we can negotiate with the orthopedic surgeon beforehand. We'll then go out to the community and get that funded beforehand so that when you go to the orthopedic surgeon, you've got the money in the bank to pay for that surgery. That specific surgery, ACL tear, I believe, was like, got quoted $24,000. I think we got it done for $12,000, which is great. So we crowdfunded the $12,000. This woman had the $12,000 in her bank account before she went and got her surgery, paid directly, done. The orthopedic surgeon was psyched. She was psyched. Emergencies, which are the big ones that people worry about, they will always bill you afterwards. So you just grab those bills, you upload them via our app. We'll negotiate them down for you. We'll go and fund them for you and then get you that money so that you can pay the hospital directly. For the little ones, you just pay and then you submit them to us, and then we'll go out and fund them and get that money back to you. So, and if you have any questions, you have a care advocate. You can reach them by text. You can call them. You can email them. It's the same person every time. You're talking to the same person, and they'll help you walk through it. So it's really, really easy. I mean, there's no time in which you should be more than, you know, $500 or $1,000 out of pocket. If you just call us beforehand, we can help you get it funded beforehand.
What are maintenance checkups, blood work, things that people are accustomed to with their regular health insurance plans that they may be asking, is this possible at Crowd Health?
So one maintenance checkup per year is fully fundable by the community, up to $300. So if you have an OBGYN, you know, annual physical, you have your primary care physical, your kids have a pediatric physical, or you have a dental or a vision annual checkup, you can submit one of those every year up to $300. If you have direct primary care, each individual member of the Crowd, of your family who's a member of Crowd, can submit up to $300 per year for that direct primary care. So that's how that works. We want people to go and see their primary care doc or OBGYN or whatever. We think that's healthy. We think that's good. We think it's inexpensive. Most of the time it's not $300, it's 150 or $200. You can get your full labs. That's included in that. So yeah, you just take that, you pay it, you take that, you submit it, and we'll go and get it funded for you.
Since you're in this community, you guys have engendered this drive for everybody in the community to be as healthy as possible. You would like, as a community member, for everybody to be as healthy as possible, so you have the rate of bills that need to be paid lower than they would be if everybody was unhealthy.
I do believe both through lifestyle, what you eat, and working out, like those two things are significantly reduced over the long period of time. And you should get the benefit of the hard work that you put in. Yeah. Like if your butt is crushing it at a CrossFit, 3, 4, 5 times a week, you should get the financial benefit of your body is in a better shape to last than the average Joe.
Yeah, which I think is important as well.
Yeah. There's an incentive to keep people healthy. Once you understand self-sovereignty, it impacts so many components of your life. So there is an incentive. You're a part of a community. And so if you don't take care of yourself, if you don't go and shop for a great price or whatever it is, you're impacting Marty and Andy and all the other people in the community. You're not impacting United Healthcare. Like, so at some point, I don't give a shit, like United Healthcare, what happens to them, right? If I'm a member, like I want to consume as much as possible because I think I'm getting screwed by them every month by me sending them a premium. When you're in our community, I'm screwing Marty or whoever, Will or whoever, Parker or whoever, right? Who's a member of Crowd Health. And so there's a new incentive to feel like, hey, I want to do what's right for the community. We had a guy with colon cancer up in Dallas. He's like, I have colon cancer. I want the best docs, but please will you help me shop for these because I don't want to screw the community. Like, that's unheard of if you were with United Healthcare. You're a part of a tight-knit community, and you want to take care of each other just as much as you want to take care of yourself. And there's a sense of altruism there that people don't feel like is scalable and things like that, but I'm not going to screw my friend, and so, this is just kind of a community of people. Like, we've seen people come back and be like, hey, like, do I really need this? Like, do I have to get this? Like, I don't want to screw the community. Like, we're seeing it. Yeah. It's just anecdotal now. I can't give you like specific stats, but we're definitely seeing it. It's changing behavior.
I'd say people in their 20s, maybe older, between 26 and 35, who are not on their parents' health insurance.
Yeah.
Plans anymore. Maybe there's freelancers. Maybe they're working jobs that don't pay them as much as they'd like to be making at this point. Maybe they're contractors. Like, does this make sense for that demo as well?
Man, it's our number one demo. Yeah. Right, that 26 to 40-year-old who's looking to do something outside of a corporate behemoth, being a small business owner, a solopreneur, an entrepreneur. Those folks are our core. We hear it so many times. Somewhere between 2 and 4 million Americans would go and do something entrepreneurial if it weren't for health insurance. And so our number one group of people are those who are starting businesses or own their own business. Number 2, funny enough, is the medical profession. Like, they're seeing how screwed up it is.
Really?
So it's doctors and nurses. We've got tons of travel nurses. We've got tons of docs who are not W-2, with hospitals and things. So we've got a lot of medical professionals.
It's a good signal.
Yeah. So yeah, that 26 to 40-year-old, man, that's our average age is 34. So that's right in our, key hotspot.
Yeah. And why now?
We have 200,000 people going bankrupt every year due to health insurance. Like, that's awful. That's why now. We have a fiscal system that is, from my perspective, breaking down because under the weight of bad governance, but a product of that is our healthcare system that's $4.6 trillion just getting sucked out of our economy every year. Like, that's massive. One of the number one reasons we're printing all this money is because of healthcare. Yeah. Right. So I think it's a direct tie to our fiscal system, and it's a direct tie to our just social well-being. Obesity is an all-time high. diabetes, which is a product of obesity in most cases, is at an all-time high. 1971 or 72, I think, the stat was diabetes was 1% of the population. Now it's 10. It's up to 10.
10x in 50 years.
And by the way, type 2 diabetes, which is a lifestyle-based form of diabetes, went from almost nothing to all that growth was type 2. We're not seeing a ton more type 1. Type 1 is you're born with it. There's just something physiologically wrong. Type 2 is you have trained your body over a period of time to mismanage the insulin levels in your body. It's worn out. Your body's worn out from pumping too much insulin into your blood. In essence, of what that is. And it can be corrected within months. 25 cents out of every dollar you're spending on healthcare is going to a diabetic. And this is something that can be solved. So you ask why now? It's like, man, it's why, why wouldn't this have been 20 years ago? Like, why not in Obamacare days? Would we have done something that was a little bit more consumer focused that could dramatically lower costs? One specific example of this, and I've just put this up on social media, birth control. Before Obamacare, you had to pay for it yourself. So, birth control was next to nothing. You see the graph. It's like, chugging along. 2010, insurance plan starts paying for it. I mean, it's crazy. Go to Join Crowd Health on Twitter and take a look at the graph. It's amazing what happens when insurance plans start paying for things. The price goes up dramatically.
In your mind, is there a tipping point at which enough healthy people opt out of health insurance and opt into crowd health or something similar to crowd health, where it really begins to change the economics of healthcare overall, where it provides a meaningful benefit to the American economy and the end consumer overall?
I mean, I think it's going to be the catalyst for the fall of the current way that we finance healthcare. And I think that can happen with as little as 1 million or 2 million Americans doing something like this. You start getting healthy people that reject the status quo, which is I'm going to subsidize people who have been really horrible to their bodies for the last 20 or 30 years. I'm not doing that anymore. I'm going to get the benefit of me taking care of myself. And just sucking 1 million or 2 million of the people out of the system will have a pretty substantial impact to the way that we operate. And so I think eventually corporations, who are the primary drivers of health insurance right now, because half of us get health insurance through employers. I don't, I'm on Crowd Health, but half of the country does. Once you get enough of those people opting out, those are put under significant stress, and those employers have to start actually looking at their healthcare costs. Whereas, crazy enough, this sounds ridiculous, but most companies don't pay attention to their healthcare costs. They kind of look at it and say, well, there's nothing I can do. How many times, if you listen to conference calls, earnings calls for for companies that are public, they say, well, what about health insurance costs? And they're like, yeah, there's nothing we can do about it. It's up again 20% this year, almost as a victim mentality, as opposed to being, let's go after it. That up 20% is going to be up 30, 40, 50%. And that's going to force corporations to take a closer look at this, hopefully with kind of the ultimate goal of bifurcating health insurance from your employment and say, hey, I'll just give you the money. You go do what you want with it. Mm-hmm. That, I think, is the kind of the golden goose.
School choice is a big topic.
Yes.
Sense in the news these days. Let's give the parents money to choose how they want to spend it on their kids' education. It makes sense we would do that with healthcare as well.
This is decentralizing all the things that back 50 years ago thought it was a good idea to be centralized. Education, healthcare, all these things should not be in the hands of government, from my perspective. Monetary policy, right? Yeah. Monetary. I mean, exactly. Same thing. I mean, depeg from gold 50 years ago. It's all what the hell happened in 1970.
What is the number one cause of concern for people who have been psyoped into believing that health insurance is the only way, who recognize there's a problem and recognize that crowd health might be a solution, but they don't feel comfortable? Maybe it's don't want to ask any leading questions here, but like, is it typically like this sounds too good to be true? Is it I'm not comfortable? I don't feel the same safety net that I feel with my insurance plan. What is the number one cause for apprehension to opt out of health insurance and opt into Crowd Health? And yeah.
What happens if? And, you know, so I can just give data. I mean, I can't change people's hearts, but I can give them data. I just said the Affordable Care Act, almost 1 out of 5 are denied. And I started the company because an $8,000 bill of mine got denied for ear tubes for my daughter, which is ridiculous. And what I should explain to them, 1 out of every 5 about get denied on Affordable Care Act. We've had now about 15,000 bills that we've gotten submitted to us. Of the ones that we crowdfunded, like I think 6 didn't get funded. So, and the reason why those weren't crowdfunded because those members were takers and not givers. Mm-hmm. So when they were asked to help other people, they said no. But then when they asked other people, they were expecting them to say yes. And they're like, wait a second, you haven't given to anybody else. Why would we give to you? Right? Mm-hmm. So it kind of self-polices within the crowd. So of the people who've given to others, 100% of those have gotten funded. 100%. Right? So I'm like, I feel way more comfortable with Crowd Health if something big happens than I do with United Healthcare.
Yeah.
Crowd Health is my ally. They're gonna be with me to fight for this bill getting paid. What do you say when you have a big bill to get paid by health insurance plans? You say, now I've got to fight with the health insurance plan. Mm-hmm. We're fighting for you. You're fighting against a health insurance plan.
Yeah.
Right? What happens if Marty has a really big thing and we don't get it funded? That's really bad for the business, for my business. So we will fight for you to get that thing funded. We will fight the hospital to get that bill down. Like, we're on your team, right? And that's the difference. And I'm like, if you can't conceptualize that and you still want like the safeness of a health insurance plan, you're probably not a good Crowd Health member anyway.
Yeah.
You're like, okay, like you'll get there. Uh-huh. You know, it might have to take some pain. And unfortunately, people feel the pain and they're like, crap, I should have done this. You know, now they're fighting with health insurance plan and a huge deductible, and they could have went into the hospital and paid $500 with Crowd Health. We want you to pay $500 to have a little skin in the game before we'll crowdfund stuff. And so if you go in the hospital, it's $500. You go in the hospital with Affordable Care Act, it could be $5,000, $10,000, $15,000.
Yeah.
So that seems way more risky to me. So, you know, and we've had, I think, almost 8,000 people now sign up. You know, it's, and go to our reviews, go to Crowd Health reviews and take a look at the reviews. It's crazy the things that people are saying about Crowd Health and how, you know, wonderful it's been for them.
Well, it's been incredible for me and my family. Thank you.
Thank you for your support.
Healthy family. Like we eat well, we exercise, kids are young and healthy. And so we don't have that many expenses outside of the one-off. One of the kids puts a rock in his ear and needs to get it removed.
That one, I was like, that one's a little bit different.
No, I mean, that's, I am an example of somebody who's opted in the Crowd Health because if I'm healthy myself, why am I subsidizing all these unhealthy people?
Yeah.
And it's been an incredible experience. So Andy, thank you for doing this. Go to joincrowdhealth.com. Check it out.
Joincrowdhealth.com. Use code
Healthy?
Healthy.
Healthy.
HEALTHY. Healthy.
It's subliminally trying to get you to think healthy. Opt out. You have options. Understand the problem. Health insurance or healthcare coverage should not be sending you into bankruptcy. This is something that should give you peace of mind, not give you stress. Your healthcare coverage, or being able to pay your healthcare cost, should be peace of mind. It should not give you stress. Crowd Health really gives you peace of mind and has reduced the stress for me and my family. So Andy, thank you for that. And until next time.
Thanks.